Hello, my name is Dan Malone and I'm just replying to a question posed in the 4.4 Pain Physiology discussion forum, which was a really good question. The question was, what receptors are likely to be responsible for post-operative pain? Would it be both the mechanoreceptors that normally respond to movement and the chemoreceptors, which are activated by chemicals? And the answer is basically that it would be both. So with regard to, similarly to back pain, as talked about in this section, there are mechanoreceptors which are detecting movement, and they can be activated in terms of post-operative pain. So following post-operative pain, when a person has an incision and therefore will have tissue damage, and that tissue damage will vary depending on the type or the size of the incision and the depth of the incision and the level of damage in the tissue. So those damaged tissues can, well, there's some evidence that they can be sensitized, or at least the mechanoreceptors can be sensitized or heightened in their sensation, or are more likely to fire in an environment that is damaged. And when a person moves around after post-operative pain, those highly sensitive mechanoreceptors can then sense more pain and send messages to the brain like this, telling the brain that there's a painful area. But probably more important than the mechanoreceptors are probably the chemoreceptors. So because, as I mentioned, with an operation or a procedure, you're having some sort of incision and tissue damage in the body, and the damaged cells then release chemicals, and those chemicals activate the chemoreceptors. Not only that, because of the whole inflammatory process, when cells get damaged, other cells called inflammatory mediators go to the area, and they can also activate these chemoreceptors and again produce the transmission of pain to the brain. So it would be both, but it'd probably be more likely to be the chemoreceptors rather than the mechanoreceptors. The degree of pain is, in terms of post-operative, is determined by many factors. I talked about the size and the depth of the incision. The amount of damage that's produced to tissue is obviously very important. So the greater the amount of damage, the more different pain neurons like this would be activated, and therefore you would have a lot of messages sent to the brain telling you that you're experiencing pain. But the number of neurons that are firing very much depends on the area of the body. So in terms of the sensitivity of the body, that's perhaps more easily explained if we look at a picture like this called the sensory homunculus. And this sensory homunculus is drawn to try and represent what our body would look like if we were not designed, but if we were existed in terms of how sensitive different parts of the body are for normal sensations like touch, but also for pain. And so, as you can see, the facial areas and the hands are very sensitive parts of the body, as well as genitalia, which we didn't draw here. But less sensitive parts of the body include the arms and the legs. So having an operation on a more sensitive part of the body may experience more pain than less sensitive parts of the body. However, less sensitive parts of the body can also, of course, you can also get pain post-operatively from those sorts of areas. Just finally, post-operative pain tends to be worse in the few days after the operation when the tissue damage is at its greatest, and then when the healing processes occur, it tends to subside over time. And pain management is obviously very important in terms of the whole management of the pain over the period of the time after the operation. And Kirsty talks more about pain management in section 4.18, more so with the case of Ari Kontos with chronic back pain. But these issues she talks about, such as tolerance and side effects and use of varying different types of drugs for pain, are also important in terms of chronic pain. So for the few days after the operation, painkillers such as morphine or codeine may be used, but then they may not be required, should only be used sparingly if possible, but then Kirsty also talked about the use of other drugs like paracetamol and anti-inflammatory drugs. I hope this has been of some help in terms of answering that question regarding chemoreceptors and mechanoreceptors regarding post-operative pain. Went off on a bit of a tangent there, but I hope this has helped.